Welcome back, everyone. The field of dentistry is constantly evolving and changing to best suit patient needs and ensure more predictable treatment outcomes.
Doctors Matthew Nawrocki and Richard Aguila with the Jacksonville dental specialists are here today as part of our weekly Dental Health Watch segment to discuss some of the new technology available in dentistry today. Thank you both for being here once again. Listen, going to the dentist is not fun. Like if you
you can have all the new technology you want, but you got to get us in the door.
Right. It's like you just think about, you know, the experience, but you guys are really trying to change the experience for patients. And how you doing that?
Yeah. A positive patient experience foremost begins with the dentist and the staff. Okay. We have a very caring and friendly staff whose primary goal is to ensure the comfort and safety of the patient. We've incorporated things that you find at home like televisions, pillows, and blankets to make you even more comfortable. So those are a few things that we do in our office. As far as technology that we've incorporated, things that patients hate about going to the dentist is getting the dreaded shot. Okay. So
they come at you with that thing, and it's right close to your face, and you see it. It's freaky.
So
Thanks for bringing that up.
But they have a solution to that.
Okay, all right, and do elaborate on that.
Yeah, we have a computerized anesthetic delivery system. It's called the wand, and when we use the wand in conjunction with topical anesthesia, it often makes the sting of the injection painless. And how the wand works, it controls the rate in which the anesthesia is given, which makes it a lot more pleasant experience for the patient. And secondly, for the apprehensive patient, we also do a lot of conscious sedation dentistry. And that's where we give sedative medications either through an IV or orally through pills that they take, which allows them to sleep through the procedure.
I like the sound of that.
And not all dentists are credentialed to do sedation, so make sure to check on the credentials and make sure that your dentist also uses monitors so to ensure the safety. So we use a critical care unit that monitors your heart, blood pressure, heart rate, and breathing as well.
That all sounds good. That's the technology that makes it more comfortable and more pain-free. But how about some of the technology, you know, about X-rays and things like that, so that you can really see what's going on? I know some of the latest stuff is so cool.
So we've got digital X-rays. That's kind of not the newest thing, but that's kind of new out there. The old film X-rays, a lot slower, higher radiation. So digital X-rays really, they speed up the process. It's instant, much more diagnostic. You can zoom in versus looking at a little tiny, you know, 1-inch film. And they've got about 90% less radiation. So in this day and age, you know, radiation, we keep hearing about that. 90%, I mean, they have about just 10% of the radiation that conventional films in the past did. So a lot less radiation, a lot more diagnostic. We can see things that we couldn't in the past, so we can be more conservative. Maybe we can do a smaller, cheaper restoration instead of, you know, till it gets too late.
The Galileo 3D cone beam CT system.
Ooh,
I want to know what that is.
Yeah, that sounds
because it sounds like something NASA made.
Yeah, you can take off in the middle of your dentist appointment.
What does that do?
We're one of the few offices in Jacksonville to incorporate this technology in the office. And what the CT scan does, it allows us to see the bone in three dimensions. And we're able to measure bone volume prior to surgery. We can visualize vital anatomical structures such as nerves and sinuses. It actually makes the precision of our surgery, our implant surgery or our periodontal surgery, a lot more, you know, exact. Okay, and the software that's used in conjunction with the Galileos allows us to actually plan implant cases and actually do virtual surgery before we make one incision. So we know exactly what size implant will actually fit into the available bone. Okay. With the planning, we're able to make these surgical guides that are custom made to patients, and it tells us exactly, you know, where and the exact depth and placement of the implant.
I think people forget how important it is, the nerves within
Absolutely.
your facial structure, and to have that kind of tool available is really critical.
Yeah, well, and technology is just amazing as it evolves, and that kind of leads me, Dr. Nawrocki, into my next question, because there are things for people who would like to straighten their teeth, not that I know anybody like that, or if they have a chipped tooth or something.
Right.
What can you do, and what advancements are there in technology to help with that?
So one thing in the field of, we're a prosthodontist and periodontist, not exactly the orthodontist, but one thing patients should be aware of, and we use in conjunction with a lot of our treatment plans, getting teeth aligned. Used to have to do the braces with the metal braces, things like that, and there's still very much a purpose and role for those, but there's sometimes some options for some people with Invisalign, clear trays that can be removed when you eat. It's easier to keep clean, more comfortable. You don't see them nearly as much. So there's been a lot of advances, and as that technology advances, the amount of people and the complexity of cases that can be treated with those increases as well. So there's a lot of advances on the orthodontic or tooth movement front.
And how has this technology impacted the way you both do your jobs?
It further allows planning and doing the case before actually doing the case on the patient, so that you can try to work out all the kinks. It increases predictability in the prognosis.
All right, well, thank you guys for being here. We run out of time, but thank you for all of your advancements in technology that you're sharing with us. And of course, thanks so much to the Jacksonville Dental Specialists for sponsoring this segment.
You can call 904-460-4201 today to schedule a consultation, or visit their websites to learn more at Nawrocki DMD.com or Richard Aguila DDS.com.